What you're going to see in this video is a short demonstration of a very simple exercise you can do to get your hamstrings and your abs, particularly your internal obliques and transverse abdominis, but you'll also get some rectus abs, the six-pack abs. But what we're really focusing on is hamstrings and obliques. Now, those are the muscles that really hold your body in this back position, which is what we want, because most people are too forward. Their pelvis is rotated forward on one or even both sides, and their back is arched, so their whole body is falling forward. So if someone were really like this, and a lot of people are, what you're going to do is when you are in this exercise, you're going to exhale, which brings the ribs down and flexes the spine. And you're also going to push your heels into a box, in something you would use in the gym, and activate your hamstrings as you tilt your pelvis back, and that is what will happen. So you'll actually see, you're going to be lying down when you do this, but if someone is in extension pattern, they're going to have, because the front of the ribs and the front of the pelvis are separating and moving further away from each other in the extension pattern, you are going to exhale and tilt your pelvis back, so your butt will come off the floor. That will engage your hamstrings, and this will happen. And then you'll hold it for 5 seconds. You'll hold the air out. You don't want to inhale at that point. Then you go back to the resting position, and then you can inhale. A note about the breathing. There is a misconception that diaphragmatic breathing means only your belly is rising. That is not what you want. Remember, your lungs are in your chest. So if you don't want compressed lungs, you better have that rib cage expanding also. So you'll see I have my hands, later on in the video, you'll see my hands, one hand is on my chest, one is on my abdomen, and as I inhale, you'll see them both rise at the same time. You have to have both belly and chest. What you don't want, when people say, oh, you don't want to chest breathe, what I hope they mean is this: you don't want to do this. You don't want to lift the chest, but you absolutely need to expand the chest. Okay? So I just wanted to add those quick notes to the video you're about to see.